Hey, listeners, welcome back to the Strategic Dentist. I am so excited for today's episode because today is extra special for me. Not only do I get to bring on someone who is incredibly knowledgeable when it comes to dental hygiene, leadership, and practice growth, but I also get to introduce you to one of my very best friends. Joining us today is Jessica Aranda. Jessica is not only a registered dental hygienist, but she has a bachelor's of science in dental hygiene, along with an MBA or a master's in business administration. What I love about Jessica's background is that she brings both sides of the practice together. She understands the clinical dentistry, the patient care, the leadership, and the business side of running a successful practice. Jessica and I, we met over 20 years ago at both of our first dental office, and we've remained friends ever since. Today, we're going to be tackling a topic that almost every dental practice has wrestled with at some point, which is incentives. Do incentives actually motivate people? Are we rewarding the right behaviors? At what point do incentives stop driving the right actions and start creating unintended consequences? And what are some other ways that leaders can create engaged, motivated team members who are invested in the success of the practice? So I'm really excited for today's episode. I'm excited to, again, introduce everybody to Jessica and to dig into this topic because I do believe this is a topic that a lot of our practice owners are struggling with. So, Jessica, welcome to the podcast.
Hi, hello everybody. And thank you, Denae, so much for having me. And again, very special moment. We do go back to our very first dental job about 20 years ago. So this is such a blessing to be doing this with you. So thank you so much for having me.
Absolutely. I am so excited. So, before we jumped on this podcast, we were kind of reminiscing about how we met. Like Jessica said, we met at our very first dental practice. We actually were working for a group practice, and we were both hired to answer phones. That's all we did. That was our whole job, 8 hours a day, was to just answer phones. Jessica started a little bit before I did. And so she had seen at least one or two people kind of rotate out of my position before I started. So, Jessica, tell them a little bit about our first interaction.
Oh, well, our first interaction, I think it was just maybe a month or two that I had started beforehand. And we were in the back answering phones. I think both of us didn't even know what a crown was. A patient would call and they'd say, I need to schedule a crown. And we're like, oh my goodness, okay, what is this? And I remember that very first week you started, you ended up the next day, I believe, getting sick, very, very sick. And you didn't come to work the next day. And I was like, oh no. I'm like, I have seen a few people rotate out of this position already. I'm like, is this going to be the third or the fourth person that rotates out? And then you ended up coming back and we were able to really tackle that back office answering phone calls and get people scheduled. And both of us moved our way up to, leadership roles in that practice. And I ended up getting into dental hygiene. You ended up getting into a management position and then moving out of state. And we just continued to grow in this dental field.
Yeah, absolutely. There's so many different doors that open up in dental, and that's one of my favorite pieces of it is you can start in one position and have all these different doors open up. It really is just dependent on what you want, right? Like where's your passion? What are you interested in? You don't have to leave the dental industry. There's just so many different routes that you can take, but you can do it through dental.
Absolutely.
And what's hilarious to me is we not only grew while we were there, like we grew together, we took on different leadership roles. Both of us were very passionate about continuing to learn and continuing to challenge ourselves. But if we're being 100% honest, we kind of trauma bonded as well, right?
Yes, definitely. And I believe it just made us stronger and it made us want to be better.
And so I went out and I branched into leadership. I focused a lot on like practice operations and the leadership piece. And you went into hygiene school. So share with us a little bit about what made you want to go into hygiene.
Well, actually, it's funny because I always wanted to be a school teacher. That was always my goal. And I found that teaching was my passion. And unfortunately, I realized that there wasn't a lot of money in education. And, you try not to make decisions based on that. But at that moment, I did make that decision. And I was getting my teeth cleaned and I was just talking to the hygienist and she was just telling me what a great position it is, what a great career, very flexible. It pays well. And you know what? Right then and there, I thought to myself, this is something I want to do. So that's when I started answering phones and kind of just working my way to that back office. Got into dental hygiene school. And I remember sitting there in dental hygiene school and I just admired my teacher so much. And I was like, you know what? That teaching kept coming back and it kept just sitting in the back of my mind. And I'm like, I'm gonna teach dental hygiene. I'm like, teaching has always been a passion. And got into clinical dentistry, worked clinical dentistry for about roughly, I want to say about 13 years. And within that time, I was still doing clinical dentistry, but I started teaching about 10 years ago. So now, in this past year, I do teach dental hygiene full time now. So it just circled back to me getting back into that education. And education is education. It doesn't matter if I'm teaching you math, science, I'm teaching students how to practice dental hygiene. And even as a hygienist, you're teaching your patients. You're teaching your patients proper oral care. So there was always a lot of that background of teaching in the career that I did choose.
Yeah, I love that. And I do think, or I can only imagine that the amount of experience that you have working chairside just really helps you relate to your students and real time scenarios of, hey, here are things that you're going to struggle with as a hygienist, or here are things that you're going to love as a hygienist. Have
And
you?
it's funny you say use that word, the real stuff that you see is because in hygiene school, you're very focused on how to do things very properly. This is how every procedure is done. And I do tell the students that we start here, we end here, and this is the proper way to do it. But I also throw in, I'm like, hey, in the real world, this is what's really going to happen. So I like to throw those things in there because a lot of these programs, some are 15-month programs, some of them are 20-month programs. They're going to be out in that real world very fast. So I do want to give them some of those tidbits.
Yeah, absolutely. And now you're teaching full time. You also went back and got your master's in business
I did.
administration. So you went back and got your MBA. What are your plans with that? Why an MBA?
Well, I didn't really think that the MBA would help me in the clinical aspect so much, but I knew that I was going to want to branch out, in which I was branching out, and I was really enjoying the education part of it. So I knew that if I went off and got a master's degree, that would really help me in some of these positions at some of these colleges, and it has. And now I teach didactic courses the clinics and in the lab. So it really did help me in that aspect. I did want to branch out of getting a master's in dental hygiene because I know that, and because you're on the business end of it, I got a master's in business because there is a business end of dentistry and I wanted to understand that.
Absolutely. I think that's what makes you so special, Jess, is you have the experience at the front desk. You've answered phones, you've checked patients in, you've checked patients out. You spent a lot of time presenting treatment plans and working as a treatment coordinator, understanding the ins and the outs of the insurance. You spent a, more time as a dental hygienist and working chairside. So you've lived not only the front office, you've lived chairside as a provider, as a hygienist, and now you get to take all of that knowledge that you have and help mentor and develop and to teach future hygienists. And then you also have the business side of it, which, absolutely helps open up doors, right? Like our industry is such an interesting industry because there are so many doors that, potentially could open up. So I love that. I love that. And how special for our future hygienists to have somebody like you that is there to help mentor and to teach them.
Yes. Yeah. Thank you. There's a lot of doors, and I don't think that people realize that there are a lot of doors in our industry. And to be able to grow in them, you need to be willing to explore other options. And I believe that's why I pursued a master's and have a bachelor's, and then got into some other, besides clinical dentistry, I was able to get into the education part. So, yeah. So, thank you.
Yeah. How was the transition going from chair side to teaching? What was that transition like?
It was hard at first because I mean, you know me, I'm very personable. I did create a special bond with a lot of these patients. A lot of them became friends and, you see them for over a decade and you get to know them, their families and, their kids. And so it was hard for me to make that decision. But I knew, it was a chapter that I needed to close for now. And in my heart, something was telling me, you know what, there's open the other chapter because you need to get into education and you need to spread some of this knowledge that you know with these students. And as hard as it was, I really do enjoy what I'm doing now. And I may get back into clinical dentistry. It's just right now, this is just where my heart is.
Yeah. I do think that a lot of hygienists in our industry that are thinking, like, what are my next options? What other doors are available to me? What piece of advice would you give to those hygienists that are currently working chairside that are looking for some sort of teaching or their next avenue that gets them out of the chair but still allows them to impact the industry? Is there any specific advice that you would give to them?
Well, I think that they need to know that it's there. A lot of these hygienists come out of school and they're like, okay, I'm an RDH, and that's not it. I just don't know if hygienists know that these opportunities are available. You could get into sales, you could get into marketing, you could get into education. There is a lot. And I think that they need to just network, talk to people, and see what's out there and see what's going to be the best fit for them.
Yeah, absolutely. A lot of the hygienists that I have talked to that went from chair side to something else, to your point, the networking piece, they didn't necessarily have a plan to get out of the chair, right? They started connecting with different people and then they started realizing what the other opportunities are and were excited to kind of push towards that. So, definitely a transition. Sometimes, most of the time, you go to school to be a dental hygienist and you want to be a hygienist. It's the same thing with our doctors. We see it with our dentists, right? They go to school, they want to be a dentist, and then they work chairside and they start wondering, like, actually, I'm loving the business side of it, or I'm loving the mentor piece of it. Same thing for our hygienists. And it's okay. I think that for me is to just let people know it's okay to change. That's what we're supposed to do, right? Like just because we went in and we said, I got my degree, I got my license, I'm certified as a dental hygienist, doesn't mean that you always have to be. It's okay to know that hey, there's other stuff out there.
And you could do a mixture of things. For a long time, I was teaching and I was in clinical dentistry. And I know some that are in sales and are still in clinical dentistry. You could do a mixture of things. And that's also the beauty of our industry as well, too.
Absolutely. Yeah. All right. Well, I am excited to dig into today's topic, which is all things incentives, bonus structures, motivation, ultimately, is what we're talking about. How to motivate our team, but not do it in a salesy, pushy, immoral way. I was excited because you had shared with me, you actually published an article about this particular topic. So I was really excited to get you on the show, on the podcast, so that we can dig into it. I do believe that a lot of our philosophies align. Wanted to talk about the concept of incentives, why practices do have incentives out there, why they work, the dangerous line that, you could potentially wobble on, and other options that are out there than not just cash paying bonuses, right? So let's talk a little bit about your philosophy, your thoughts on incentives in a dental practice.
Well, I wrote this article because I needed to understand why bonuses were in place. And my mindset was always from day one that it's a negative. It's about pushing production on people. And that was just always how my mindset was. And I remember this instructor in dental hygiene school, and she would always say, the production is there, the dentistry is there. You don't need to go looking for it, it's there. And if you look at my article, it talks about caries being one of the most chronic diseases out there for adults and children, and also periodontal disease. About 50% of the population roughly has periodontal disease. So it's out there and you don't need to go looking for it. You don't need to go digging for it. It's not hiding anywhere. And that always stuck in my mind. And then that was in school. And then I get out into the real world and the bonus structures is there. And I remember a dentist that we worked for. I remember him saying one time, there shouldn't be bonus structures in healthcare. Why does that exist? I was 20 years old. I didn't really think much of that. And I wasn't even in that back office getting that bonus. So I didn't really think about it. But as I got in the back, I just started to think, and I always just had this negative outlook on it. And so I wrote this article so I could help understand, because there are positive reasons to have a bonus. There's other reasons than just to push production, but I think that what ends up happening is the way that it is presented to us as a provider, that's how we take it. And I believe that offices, managers, practicing owners need to present it differently. Be like, here's is a bonus structure. Let's say, for example, a sign-on bonus structure. The sign-on bonus structure is to find quality workers. Maybe a structure if you stay on for 3 or 4 years. Well, you know what? This bonus structure is to help keep those quality workers. A referral bonus. Jessica, I have a friend, Denae, I'm going to refer her on, and she's a quality worker too. So those referral bonuses are all positive ways to think of these bonuses, as well as, you have that provider that holds them accountable to, patient care or to diagnosing that periodontal disease, to go in there and do all the right things you're supposed to do. Go in there and probe every single patient so you could find that periodontal disease if it's there, and then you treat them properly. And it goes back to my instructor saying that the treatment is there. You don't have to look for it as long as you're just treating patients in the proper way.
Absolutely. Absolutely. I think what's interesting is the reason behind the bonus structure is typically valid, right? It's, hey, we want to give back to our team. We want to reward our team. When the business is doing better, we can give back more team, but it's trying to figure out how do we motivate them in a way that's not going to push our team. And this is where most people get uncomfortable with it is, are we asking our employees to do immoral things? Right. And sometimes I have seen it to where that line is very, very close of, do we recommend this treatment or do we hit our bonus, right? Do we not recommend this treatment or do we not hit our bonus? And so that's the fine line. And to Dr. Thompson's point, should bonuses be a part of healthcare? I like to think back to, if I'm going to a medical office, how would I feel if I knew that the number of mammograms that get done, right, is dependent on whether or not my healthcare employee, the person that sees me, the doctor, gets a bonus, rather than them just recommending you need the mammogram. But there's this fine line of, did they recommend the mammogram because I needed it, or did they recommend it because they were going to hit bonus? And that's that concept that a lot of our hygienists, a lot of associates, a lot of our dental assistants, and oftentimes even our front office, that's that fine line of, are we rolling this out so that we can incentivize our healthcare providers to recommend treatment that patients don't necessarily need? And when it's rolled out wrong, right? When it's rolled out underneath the wrong leadership, it unfortunately can get pushed out that way to where employees are feeling the pressure to do more crowns. Maybe we could do a filling, but we're going to do a crown on this just because of production. So it absolutely can get employees, practices, people in a really sticky situation. And I don't think that's where anybody wants our industry to go. I don't think that's where nobody wants to go to the dentist and feel like, do I really need that? Right.
Yes, yes. So we've all felt it. And I think you're right. I think that there is a fine line that can easily be crossed. And I think it just goes back to it's how it's presented to the employees rather than it feeling like it's more of a production based bonus. Like it's more of a, hey, you know what, let's create these bonuses here so we could take accountability of, just treating the patients properly, how they're supposed to be treated.
Right. Absolutely. So there's other ways to go about a bonus. There's things like, to your point of employee referral bonuses. There's other ways that you can motivate your team to bring the right team member on board, that kind of stuff. One of my favorite, and this is usually what I recommend to all of my clients, is if you are looking at giving back to your team, you've almost maxed out where you're at from an employee compensation. You can't continue to give increases and increases and increases. What I usually will recommend is, don't tie it to production. Don't necessarily tie it to collections. Do more of a profit based bonus structure. So you can tell the team, the better the business does, the more I'm able to give back to you. And that way, it's a win win. The doctor is able to give back. Hey, the business is thriving. I want to make sure I'm rewarding and recognizing my team. If we have more profit, then I'm going to give back a little bit of that to the team.
Yes.
That also allows the owner to know, I'm not guaranteeing a higher hourly rate because I don't know what the numbers are going to look like, right? So it's covering both the business and also still allowing you to let your team know, I'm going to be able to give back to you guys. It's not just production. It's not just more crowns or more scaling and root planning or more fluoride. It really is all about your margins. Are we making sure that we're being hyper diligent with our supplies? Are we being hyper diligent with our redos? Like, how many cases are we resending to the lab? There's littler things that you can kind of tweak that is the big picture. And I think that most doctors, owners, they want to roll these incentives out because they want to give back to their team. But when you roll it out in a way that it's all about pushing production, I think that's where a lot of the line gets. For me, I think there's a win-win. You can tie it to profit. It's not about production, it's about the business. And here's, I can give you more because the business is doing better instead of pushing per procedure or production or collections solely.
Yeah, and I completely agree with that. And I both have worked at a few different offices. And when you get those folks together that work as a team and are a good quality team, the production is there and the office produces as a whole. And if the office exceeds the numbers for that month, they are treating the patients that they are supposed to be treated. And like said, the treatment is there. We don't have to go look for it. But if we're a good quality team and we work together, then those numbers are going to be there. And to be able to give back to your employees is just going to make that team even stronger.
Absolutely. Absolutely. I have had doctors that have said, yep, the production is there, but my team's not talking to patients about it.
Yes.
They don't have the motivation to follow up on unscheduled treatment. They don't have the skills yet to confidently talk to the patients about why they would recommend fluoride or why they would recommend an implant over a bridge, right? They're not confident enough to go there. And so I think a lot of doctors try to push the production and the procedure based bonuses out to motivate them to build that skill set. What would be your recommendation or your thoughts for those doctors that are like, well, I'm trying to get them to like really focus in on the systems and to focus in on the conversations that they're having with patients. And the only way for us to measure that is procedure or production. How do you motivate in that case?
That's a tough one to tackle if we do the approach of training sessions. Being personable and talking to patients and being able to explain everything could be a skill as well. Not everybody has that, and maybe that needs to be something that could be taught too. And maybe as a team, we do trainings or CEs or other activities that could help us help those people communicate better with the patients or the staff or everybody just as a whole communicate better.
Yeah, cannot agree more. I think that if you have an employee that's struggling with something, it's not about bonus systems and motivation and incentives. It's about supporting and mentoring them and training them. So if you can clearly say, hey, here's what I expect of my hygienists. I expect that they're confident talking to patients about perio. I expect that they're confident talking to patients about perio maintenance or whatever it is that the patient needs. That's my expectation, is that they are very comfortable having those conversations and educating the patient on what is going on in their mouth, right? Or going on with their overall health. That's a training thing. That is a mentorship opportunity. That's something that you can hone in with them and say, hey, most of our hygienists, right, are seeing X number of patients. And of those patients, this is typically the amount of perio that we would see. Let's walk through some of the patients that you've seen. Let's dig into their accounts and figure out what's going on with them. There's a lot that you can see in the patient's chart. And if you're able to identify that they are missing certain things with patients, use that as an opportunity to train and mentor them instead of just throwing cash money to incentivize them to do it.
Right. Yeah.
Yeah.
And looking into the future of dental hygiene, that kind of goes back to maybe hygienists need to be under contract. Maybe that's going to be able to retain some of these hygienists, and it sets a clear expectation for the hygienist. This is what we expect from you. You're going to be on with us for X amount of time. And it just sets a clear path for the hygienist as well. It sets a clear path for the office or the dentist because they're not worried about their hygienist leaving because the next better sign on bonus is there or the next better office is available. So I believe that maybe that can be something that, can be looked at for the future. Nurses are on contract, PAs are on contract, and maybe we need to be roped in with that whole healthcare provider. And maybe that needs to be something that can be looked at in the future.
Right. Yep. And I do think that step one is knowing exactly what your expectation is. So if you were to create a contract, whether it is an actual contract like nurses or PAs or a job description, right? it has to be very clear of what your expectations are so that your hygienists can deliver, right? Your dental assistants can deliver. Your job description, I think a job description is one of the most underutilized and undervalued tool in a dental practice. The impact that it has on the employee's success, your employee retention rate, and your business is huge. It is the one tool that you have to set clear expectations, whether it's a contract or you have them on as an employee, right? Having very clear expectations of what it looks like to win as a hygienist in your office is going to be step one, not throwing bonuses out there. Not every hygienist has the same background. Not everybody has the same skill set. So if you can paint a very clear picture of what it looks like to win as a hygienist in your office, then your hygienists or your team is going to be able to they're going to be able to show up. But if
Like,
they know what you expect, they can't show up.
yep,
But a lot
that's
of times they just throw money out and they're like bonus and then you'll elevate to the skill set that you need and that's very rarely the actual solution.
absolutely. I think that just throwing money out everywhere, that I think that that could get sloppy. That could just create a lot of issues. You don't know how many times I get on my social media and follow some of these dental hygiene accounts, and you have that hygienist complaining, like, hey, my office manager told me if I have a cancellation, I clock out. That's not, what am I supposed to do about that? Does everyone do that? And I'm like, that should be clear. Like, you should know if that's what you signed up for or not. So I think that's just a muddy area for dentistry. You're absolutely right. Everyone needs to have a clear path, and then the office is going to run a lot smoother if those clear paths are created.
Agreed. Yeah. So if you have very clear paths, very clear expectations of what you need from your team, you're not going to feel this pressure of, well, if I give them a bonus, then they'll talk to patients about perio, right? Or if I give them a bonus, then they'll do more fluoride. It's not necessarily about the bonus piece of it. And honestly, most hygienists that I have met are not motivated by money. Most hygienists that I have met are more motivated about patient care and doing the right thing and building relationships and continuing to educate. Like they're constant, they're always learning. So knowing what's actually the issue is like set expectation, create a clear path for them. And then if you genuinely do want to give back to your team, give back to them based off profit. Don't throw out collection bonuses. Give back to them based off profit and say, hey, the better the business does, the more I'm going to be able to give back to you.
Right. Yes.
I like it. All right, Jess. So, what is one piece of advice that you would give our listeners before we get off the call?
I think that if offices start to focus more on prevention and not production, you will see a lot of success in your office, and you'll have a lot of happy employees. You'll have a lot of happy patients, and a good recipe for a very successful office.
Yeah, absolutely. Amazing advice. Prevention of not only perio, but prevention of your employees not knowing their jobs.
Yes, prevention all around.
I love it. All right, Jess, it was great to have you on. Lots of really good information here. And I think if nothing else, it's just walking away knowing that, yes, you probably have the best intentions when it comes to bonus structures. Most owner dentists do. They're trying to motivate their team to deliver on the care that the patients need. I have yet to meet an actual dentist in person that is doing these bonus structures for the wrong reason, right? Like they genuinely are trying to, but when we're rolling it out and we're giving that freedom, it could cause a lot of pressure to your team that, hey, if we're going to hit bonus, I might want to actually recommend this. Just know that that's a reality that your team is feeling. And so if you want to avoid your team feeling that pressure and you want your team to genuinely be able to focus on patient care, which every doctor I've ever met, that's what they want. If you want to be able to do that, know that it's not always a default of a cash bonus. There are other ways for you to be able to give back to your team, things like profit bonuses or employee referrals or things like that. It doesn't always have to be a production based bonus structure. Lots of other ways. Get creative. If you're like, I would love to do that, but what does it look like? I would say reach out to people, network with people, talk to people. I'm happy to help create some kind of profit-based bonus structure where your team feels like, hey, I'm not getting the pressure. I'm doing the genuine care that I need, but you're also able to give back. So, lots of really good information here. But until next time, guys, this is Denae Black and Jessica with Dental DNA, just reminding you guys to dream big, plan smart, and then make it happen.